Welcome back to the Blackletter podcast. We set out to create an entertaining and exciting podcast about law and business. Blackletter, the name, comes from the Gothic typeset. Over time, Blackletter became the only font that English law books were printed in. It made it harder for kind of the common person to understand what the English law books said. Blackletter came to represent something that was law, that was set in stone, that was sort of old and a well-settled fundamental principle of law. We're here to demystify black-letter law. We're here to demystify things that happen in business and law and where those two meet. And I hope you have fun listening. Hi, this is Tom Dunlap. Welcome back to the Blackletter podcast. Thanks for joining us again. Segment two. Darrell Moon's back from Orriant. And Darrell's going to tell us this week about a challenge he had or something that went well or bad or whatever it was, but how he overcame that and how that evolved or changed his business and his outlook. I don't know what it is, so I'm going to be as excited as you are to find out. Darrell said he's got something. So Darrell, tell us about your business challenge and solution.
It's been interesting as I've been working to promote prevention and getting people upstream and addressing problems early. I didn't know after many, many years of being in the healthcare industry that there was actually a healthcare system out there in the world that we could put on a pedestal and say, there's the best healthcare system in the world, and this is how it works. I learned a few years ago that there actually was a globally recognized healthcare system better than any other system in the world. And it's called the Nuka System of Care, and it's in Alaska. And I'll tell you quickly about the story behind this amazing, globally recognized best healthcare system in the world. So 20 years ago, the federal government, who writes these treaties with the Native Americans that say, we're going to take care of all your health care, passed a regulation and said, look, we know that the federal Indian healthcare system is not the best system in the world. So they said, if any of you Native American tribes would like to take over and do healthcare yourself, we will let you. So this very innovative group called the Southcentral Foundation in Alaska, who represented 190 Native Alaskan tribes, like 60,000 Native Alaskan people, said, look, our population health is one of the worst in the world. We have major health problems. We're spread all over the southern Alaskan tundra. And
Right.
we have a very inefficient and unsuccessful healthcare system. We can't make this any worse than it is. Why don't we take on the opportunity that the federal government is giving us and let's build our own healthcare system? And they did something that no one ever in history that I know of has ever done in creating a healthcare system. They went out to their customers and they asked them what they wanted. They spent 6 months with consultants asking their 60,000 members and their tribal leaders, what would you like from a healthcare system? Because we're going to build a new one. The primary message they got from asking their customers was, we don't want a paternalistic system that tells us what to do. We would like a healthcare system that journeys with us through life, helping us become the owners of our own health and live life to its fullest. And so Catherine Gottlieb, who was the CEO of the Southcentral Foundation back then, said to the medical staff that they were inheriting from the federal Indian healthcare system, we're going to build a system like that. And they said, we were trained in the US medical system, and we don't know how to do that. We were trained to be diagnosticians and treatment plan creators. We don't know how to do what they want. And she had the tenacity to say, then take a hike, because that's what we're going to build. And she built a healthcare system that was architected to be a massively powerful primary care system that's primary job was to reach out to their members and support them in taking ownership in their health and supporting them in living life to its fullest. Now, 20 years later, the only healthcare system that has won the President's Malcolm Baldrige Award twice. They're recognized globally around the world as the most effective and successful healthcare system anywhere. They have 97% patient satisfaction. They don't call their patients patients. They call them customer owners. They have 95% employee satisfaction with amazing retention. And they do all of that. Plus, they've moved their entire population from the low 5% of all HEDA scores. Now they're in the top 75%, and in many cases, the top 90% of all HEDA scores. So their population has improved health, and they do it for half the price.
Why isn't there more than one of these? Why isn't the healthcare system, if it's been 20 years and they've won awards from the president and everybody knows about that and everybody's like, this is the best system,
Yep.
how come nobody's copying that? Or how
I
come how come we're not doing that?
I asked them, I said, who comes to your conferences? They're willing to share their story with everybody. They hold 3 or 4
Yeah,
conferences every year. I said, who comes to your conference to learn about this amazing healthcare system? Well, Singapore's mirrored a lot of their program over it, Sweden, Finland, the UK, Canada. Does anybody ever come up from the lower 48? No, not very often. I'm like, that's a problem. Nobody wants to fix a system that's financially benefiting the system. And I said,
right.
look, I speak to CEOs all across the country. I'm the top speaker for Vistage, world's leading CEO organization, on this
Yeah.
topic, controlling healthcare costs and improving employee health. Will you put on a virtual conference with me last July where I can bring with my influence as many CEOs to hear your story? Because the buyers of healthcare need to know there's a better way. And until they know there's a better way, they'll just keep allowing this perversely aligned system to just keep doing what it always done. The system's not incented to fix it for the customer. So I say it's getting away with not meeting the customer's needs, and the customer isn't demanding more. So the whole healthcare system's like, why would we change anything? It's incredibly profitable to leave the system where it is. Now, there are pockets. There's another Native American group in Cherokee, North Carolina, that has mirrored their program after the program in Alaska, having the very same kinds of successes. And like I said,
Wow.
other countries have taken this and applied it. But my clarion call is employers. And this is where we come in as a company. We can show you, Mr. Employer, how you can offer, we call it an aspirational healthcare benefit. So what Nuka built was an aspirational healthcare system versus a deficit based system. And employers can get that by simply the way they spend their money, by creating three simple things: alignment, choice, and relationship. In fact, my Forbes article just came out this morning about these three concepts. Any employer can have a Nuka type model benefit for their employees by simply changing the way they spend their money. And so we're
Wow.
helping employers across the country not just implement coaching, but literally transforming the entire healthcare system by the way they spend their money.
Is that part of your personal mission or part of your company's mission to
Oh,
actually not just to sell your services, but also to change the healthcare system?
absolutely. Both.
So
Our
that's,
whole
I mean,
thing is to rise up and be of good cheer, not only for individuals, but we got to fix this. Healthcare is our nation's greatest financial economic crisis. It continues to go up faster than every other industry. And it's because there's this misalignment. And that's why I say alignment is the very first pillar. You've got to get the employer, the CEO, to go, wait a second. What do I want from healthcare? And who have I aligned to help me get it? And they don't.
right.
They don't actually say, here's what I want. And now I'm going to monitor it to see if I'm getting it. And I'm actually going to set my own internal team who's helping me get healthcare to accomplish it. And they never go out to their consultants or brokers or benefit, agents and say, you too are going to be aligned. And so we're teaching CEOs. The first thing is to align your internal and external teams to help you reach your goals, which are to attract and retain top talent, to improve employee health, because when people are healthy and productive, you get a better product and your
Right.
customers are healthy.
100% agree with you. Yeah. And
So
I think, how great is it for you to have a mission that you're aligned with that goes hand in hand with the business that you do? I mean, I can just see your passion. I feel like if I'm going to give advice to entrepreneurs after talking with you, Darrell, I'm thinking, be aligned, have a bigger mission than just your business. I mean, it's fantastic. I think that's so important, and I love that about not only the problem that you brought to me today, which wasn't really a problem, except Your problem you brought was our whole healthcare system in the United States is messed up. It's completely broken, and here's a place where it works, and we're not doing that. So it's fantastic. Next week, Darrell's going to come back and give us his one or two or three pieces of takeaways from his career in putting this business together, and from his entire career and making the leap as an entrepreneur. So, Darrell, thanks for joining us this week. And thank you, guests, audience, listeners, for joining us on the Blackletter podcast. Download us wherever you get your podcasts, iTunes, Spotify, iHeartRadio. We'll see you next week.
That's all for today's episode of Blackletter. Thanks again for listening. Join us next time when we talk about more Blackletter issues in creative ways. Make sure you subscribe to the podcast so you never miss an episode, and check out our website at blackletterstudios.com.